Fox 5 Health News, and for the first time, the CDC releasing new guidelines for treating kids with concussions.
All right, joining us now, Dr. Jennifer Caudle, a professor at Rowan University. And this is big, obviously, high school football, soccer, all that stuff's back in session.
Yes.
And this is based on a lot of information for the past 25 years.
It really is. And this is really important because we've needed guidelines to treat pediatric mild traumatic brain injury, which is another way of saying concussion.
Right.
And these guidelines really are for doctors to tell us, okay, when do we order CAT scans, when do we not? How do we recommend brain rest to kids? How do we counsel and educate parents? So it's 19 guidelines released by the CDC, and it is a combination and a conglomeration of like 25 years of best evidence and practice. I'm so happy to see it. We're back in the school season. Kids are going back to sports, and we need to really keep kids safe.
Right. So what are the guidelines? What's changed?
Oh, there's so many.
Yeah.
I mean, there's so many, and they're 19. And that's the thing is, what it does is, like, for example, let me give you an example, right? So CAT scans, right? CAT scans do not need to be routinely ordered for a mild traumatic brain injury, but there are some caveats where it does need to be ordered. So that's one example of the guidelines. But all of these, again, they range from imaging to labs to what do you do, how do you do the impact testing to sleep for kids.
Right, and you said brain rest.
Brain rest, right. So 19 of these, that's really sort of a really well-rounded, balanced way to approach a child with concussions. Yes.
And to be clear, this is the doctor's responsibility to know. I don't have to worry about this as a parent.
You don't. Right. You don't, but I think the good thing
I should know about it.
You should know about it, but I think the good thing for parents to know is that now we have these guidelines, and this is good for parents and kids because we need to be treating kids in an evidence-based way. The other thing is parents can go to cdc.gov, and there is a section on there about concussions that will help them kind of know like when to worry, when to not, things like that. So that's very helpful.
Yeah, it's tough not to worry about that. It is for sure. All right, well, and a possible game changer in the fight against superbugs and antibiotic-resistant bacteria. Basically, before we didn't think they worked well together if you've got a resistant infection, but now there's evidence that they actually might work really well together.
I love how you said that. That's kind of like in a nutshell. So microbial resistance is this idea that viruses and bacteria, they get super smart. They can outsmart the bacteria and the drugs rather, and they mutate so that they can't be treated by the drugs we have against them. That's what antimicrobial resistance is. Well, researchers at UCLA came up with a mathematical algorithm that suggests that perhaps multiple drugs might help us get around that problem. Now that's significant though, because think about it, when you have a sinus infection, if you need an antibiotic, does your doctor give you 5 drugs to treat that sinus infection? No. Typically we've thought 1 or 2 drugs for the most part, unless you're really sick in the hospital. But these researchers said, well, maybe, and they've come out with maybe 3, 4, 5 drugs might help us.
A cocktail of drugs.
Cocktail might help us get around this antimicrobial resistance issue. We're a long ways away from putting this in place. I think it's super interesting, and I think it has a lot of implications.
It is hopeful because all the news on that front has been bad for a long time.
And it also gives you the opportunity to tweak them as you need.
More flexibility and more options.
Gotcha.
Thank you. That was very interesting.
Jennifer Caudle, we appreciate it.